Welcome to True Out Tuesday, and the truth will set you free. We got some exciting stuff coming up in the next couple of weeks, but tonight we're going to show on the approval version for our comrades back in Washington that they will accept this, so that's kind of nice. We're not going to talk about anything that would offend them. The second part is really kind of fun. There's, I'll tell you later. So please, the people that are on the Dr. B VIP site, they're just going to walk right through. They're going to see the censored and non-censored part. But the key is when you get on the Dr. B site, don't just watch it. Get the PDFs, share this, get the talks, get everything, because this is a revolution. In the next coming weeks, we're going to talk about the American states' assemblies on how you can actually take back your rights as an American. Because like if you were born in this country and you had the idea that you had the right of freedom of speech, freedom of assembly, that you had certain rights that couldn't be separated from you, I'm going to show you how to get those rights back so you do not need to worry about the forced medical procedures without informed consent. We are going to take that back and guaranteed. It's also going to be on Extreme Health Academy, so Doc, don't worry, buddy. I got your back. And that is not a chiropractic term, it's more Italian. I got your back. Okay, so when we're looking at posture, and this is going to be how to identify disease, it's also why I can't go to Walmart or Target. Okay, because when you look at this, you're going to look at, my gosh, posture literally tells you stuff. So think about way back. Like have you ever walked with somebody in the hills and they can pick up a piece of poop and they can say, yeah, this is from, they'll name the animal. They'll name how many hours old it is, which direction the animal was, where it came from, and you're going, damn, that's all from poop? Well, I'm going to turn you into trackers for humans. So when we look at normal, and you see normal up there on the left, normal's amazing. And we're just going to look at the normal curves, but I'm going to show you what's underneath those curves. Now, the head should be placed over the pelvis, but we have these different levels here, and you'll see middle of the shoulder is where it could be. If that heads forward, that can cause a whole change of dynamics here. Does that make sense? So what would cause the head going forward? Because when that head is in alignment, you can't really crush this. It's amazing. And even the joints here, they're called facet joints. They're placed at 30 degrees here, 60 degrees here, 90 degrees here. They're placed to maintain this configuration. So when you hear the stuff, and I hear this all the time, well, my dad has this shoulder, I must have this. No, human beings are designed like this on the left. You may have had similar traumas in the past. Okay, cool. If you've had, then you have similar adaptations. Okay, does that make sense? Now, let's say that you've got a 12 to 15 pound head. That's everybody except kids. Okay, now let's say you take this and it's designed to have a shock absorber. Let's say you take it and accelerate from 0 to 50 miles an hour in 100 feet. And then you decelerate that from 50 miles an hour to 0 in 50 feet. Okay, what happens to the neck? Now, I'm just describing, I know. Yes, God. Well, I'm just describing driving down Beach Boulevard. Okay, that's starting and stopping. Also, too, that curve in the neck is called the Ark of Life when we talk about this. But those traumas that you go through, birth process, if you've gone through a C-section, you're talking 4 times the amount of pressure on a kid's neck as opposed to vaginal birth. You're talking wrestling, falling, this. I mean, how many adults in here, when you were kids, your parents said, don't do that, and you did it? You better raise your hand. I know you did. Okay, yeah, everybody has. And you're getting back for it. So kids, when you're in here and the parents say, don't go down that slide backwards, they probably already did and hurt themselves. Okay, but what that causes is it's thrown forward. Now, all the muscles that support that head stop in the middle of the back. The curve in the back is called kyphosis. And if that kyphosis is damaged, okay, or if the head gets forward, no one's walking around like this, okay? So then they have to decrease the kyphosis to get that head over. So you can have an original trauma that eliminates the curve in the neck, but the body's not going to be walking around like this, so the kyphosis is going to change. Let's say you sit. If you sit, you're going to sit on this butt bone here called the ischial tube, and that's going to flatten out the curve. Oh my gosh, that causes the head to go forward, doesn't it? So if you're sitting down, when you're sitting, the pressure on the L5S1 disc increases 5 times normal. Golf increases at 8 times normal. So people that sit a lot, the body is going to move forward. Okay, and I'm going to show you solutions for all this, but let's look at the end result of what modern life does. So we have normal up here on the left. Everything's balanced, beautiful, great. Person next to that, can you see the head's forward? Okay, and the shoulders are rounding over. Now what happens when that body rounds over and opens, there's holes here called intervertebral foramens, where the nerves come out that supply everything. So if we see an increased curve here, that means the body is trying to take the pressure off of the central nervous system. Now the nerves at the top of the thoracic area are really important. Now you have an automatic nervous system. One part keeps you alive under stress, that's the sympathetics. The other part regenerates tissue, that's the parasympathetics. Sympathetics is located from here to here. Okay, it's called thoracolumbar junction, or it's thoracolumbar. So this right here, if there's any pressure on there, that alters heart function, it alters digestion function, it alters the automatic activities that you don't need to think about. Okay, does that make sense? So head goes forward, or you're sitting, that puts the body under an abnormal force loading. Does that make sense? Okay, now the body is going to compensate by changing that position. So when you're looking here, you're seeing forward head carriage on that gal on the second. Now, knowing that all the nerves that supply the arms come out of the base of the neck. So that means carpal tunnel syndrome, rotator cuff problems, golfer's elbow, tennis elbow. All of those conditions are double crush injuries beginning in the neck. So when you're looking at this person, could you say, wow, have any shoulder issues? Got the numbness and tingling, got the carpal tunnel syndrome? Because you can predict that with the head being forward. Now, if you're looking at an x-ray here, you've got big bullhorn ribs, okay, that at the start. And then the ribs get longer and thinner and go at an angle. So you literally have this pyramid of a chest. And it's like that so you can hold a great weight, okay, on the chest. I mean, it's fantastic the way you're designed. The problem is that's the only opening for the outlet of what's called the thorax. And this is where all the blood vessels come out, the blood vessels go in, you got the food tube and the air tube. So if that heads forward, you're choking off the blood supply to the shoulders. So if you have somebody with forward head carriage, their arms are going to start to rotate in, and we're going to see a massive postural distortion. So what happens first? First, forward head carriage, okay, or sitting, the altered biomechanics, flattening out the curve. Then the body rounds over. Then it's going to start to distort in. And I'm not even talking about the football traumas, the motorcycles, this going down the slide backwards, okay? All of the stuff that we've all done. Now, you look at the gal on the end, the far right, her body is comfortable in this position. It's adapting. It's taking pressure off. The problem is the body can adapt only so far and then it decays. Does that make sense? Because just try it. Sit where you are now, okay? And round over like you are that gal on the fourth. Okay, now, while you're in this position, try taking a deep breath. Okay, now, I know it sucks. Okay, now go back and take a deep breath. Easier to breathe. So what you're telling me is that if you have an alteration in posture, that's going to alter breathing and physiology. So if you can't breathe, you can't do oxygen transfer. If you can't oxygen transfer well, what do you think has to happen to blood pressure? Oh, it has to go up. So you're talking rounded shoulders are going to elevate blood pressure because you can't do the carbon dioxide oxygen transfer because you're losing the surface area. When you breathe, the ribs move in a bucket and handle action. When you're curved over like this, they can't move that way, so you can't expand the lungs. Does that make sense? So what you're looking at here is shoulder rotator cuff problems in the second gal, shoulder issues, possible heart problems, heart palpitations because she's distorting her body posture. But on the end, if she's had that posture for a few years, what is she going to be misdiagnosed with? High blood pressure. Okay. Is her cancer rates going to be bigger? Yeah. You got that little 3-pound brain that burns 90% of the body's oxygen. Can she do good oxygen transfer there? No. So we're going to go over the solutions. Okay. Does that make sense? Now, and a lot of times when I was teaching, I would give answer or questions that were mean. I'll give you one of the mean questions now. Okay, who would like to massage and relax the body before you give the adjustment? Okay, and you're talking like 8-10 people around the dead body because we're teaching human dissection. You get somebody, oh, I would. Okay, you would kill that person. Okay, so think about this. Okay, we got normal. For every 1 inch that heads forward, the pressure on the discs up here double. Now, is the body smart or smart? Good. I'm only giving you one choice. Easy. I can pick that on a multiple guess. So you get that going forward. All these muscles that you do not have conscious control over are going to increase in tone. So for every 1 inch of forward head carriage, the pressure doubles. Those muscles fire off. So when you go to a doctor, okay, that doesn't know crap about the biomechanics or neurology, and doc, my shoulders are tight all the time. It's right in between my shoulder blades. I can't sleep hardly. Here, take this muscle relaxant. It's a central nervous system toxin that attacks the base of the brain. No, they don't tell you that. They say the muscle relaxant is going to relax the muscles. Oh, you got pain? No problem. I'll give you a non-steroidal anti-inflammatory. Except the non-steroidal anti-inflammatory, Motrin, Advil, Aleve, okay, destroys joint cartilage or the proteoglycan production, the building block of cartilage. So, but nobody asked, why are the shoulders tight? Let's look at his posture. You don't even need to take an x-ray, okay? All you need to do is look. Okay, does that make sense? If that ear is in line with the shoulder, you're fine. If it's forward, it's bad. If it's forward really bad, okay, there's going to be certain pathologies. So what kind of things come from the neck? Asthma, breathing problems, cardiac arrhythmias, okay, come from here because the nerve to the heart comes out of here and here. You got the parasympathetic supply at the base of the skull. Sympathetic supply to the heart is at the top of the thoracic area. So could that guy have that? Possibly. Don't know. So when people come in and sit down and say, yeah, doc, I'm just here for wellness. When did you have your trauma? No, never had an accident. Never had an accident. Just fine. And I'm looking, okay, both his hands are internally rotated. He's lateral deviated. Dude, your head is shifted like this. Okay. No, I haven't had that. Well, when I was a kid, I went hockey and got knocked unconscious by throwing, but people don't know that, okay? So it takes a little bit more detective work. Now, this is what we check for autonomic dysfunction. Now, the autonomic nervous system is actually located in the spine. Okay, that's why it's so important. I just had a patient today that says, oh, okay, you're going to straighten up the spine and that's going to fix my digestion? No. Okay, right now your spine looks like this. Okay, you have a 10-degree lateral deviation here. You got forward head carriage, no curve in the neck. You have evidence of trauma over 20 years. We have an automatic nervous system. One part keeps you alive under stress, that's sympathetic. The other part regenerates tissue, that's parasympathetic. And we have a balance of the system that has to occur. Your structure is showing me that you've been in a sympathetic dominant or a stress state for more than 20 years. That decreases nerve supply to the gut. If you continue on with this, taking the antacids and the muscle relaxants and the pain relievers, you will die early, okay, because it is not muscle relaxant deficiency syndrome. So what we're going to do, we're going to change the structure. We're going to look at the physical, chemical, emotional stressors to get you out of that stress state so you have a balanced autonomic nervous system. Then you're going to start having healthy digestion. But since you've had crappy digestion and you've been drugging the hell out of yourself, we're going to start to build the gut flora. We're going to get you really good nutrients. We're going to get, but first we got to restore the nerve supply. Does that make sense? And that's what he said. Yeah, that makes sense. Okay. I just want it to make sense to everybody. It's just because it makes sense to me. So this is how you live your life. You live your life through the nervous system. Okay, does that make sense? And anyone that has been diagnosed with type 2 diabetes, inflammatory bowel disorders, high cholesterol, and high blood pressure, those are not diseases, those are stress adaptations. I know what you're thinking. Wow, that makes so much sense. Because what are they going to say? No, it must run in your family. Name an animal species on the planet that can't regulate their physiology. I'm not talking about the inbred chihuahuas that used to be a wolf, okay? I'm talking about the ones that we haven't messed with, okay? Show me a water buffalo or a caribou or a giraffe. I know what you're worried about because giraffes have the highest blood pressure in the animal kingdom. Yeah, they got a brain 18 feet in the air. You try and get blood up there, dude. You got to have a pump. Okay, so you look at this, these aren't diseases. They're really adaptations. So wouldn't it be, it seems strange to lower somebody's adaptation. That's like removing the alarm without fixing the problem. Doesn't make sense. So here, what you're looking at, and this is hugely important. This guy, okay, I know it's going to sound weird, but his kids produce the cutest grandkids you ever saw in your life. Okay, Michael, if you can hear this, is my oldest son. Danny, if you could hear this, okay, let's beat him on the grandkids. I don't have any yet. Okay, so when you're looking at this, I wanted to point to the kyphosis. Kyphosis is the curve here. Now, obviously, the head's forward. You'll see we're looking at before and after, but before, the head is forward. Okay, body like this. Now, you'll see his legs are going to spread out and the body forward. Now, has anyone ever heard of blood pressure medication? Okay, you've heard of it. Okay, do you think it helps oxygen to the brain or slows it down? Slows it down. You know how many times I've told that to a patient? They say, well, I'm not a doctor. Okay, you're taking a drug that lowers blood pressure. Does that help oxygen or slow it down? And I'll say this to people in the office. Do I say it? Yes. I'm done with caring, you know? So when you look at this, the guy's body is forward, his shoulders are rounded out. We're seeing that there's not a good curve in there. In fact, there's a suppression here, an accentuation of the curve up here. So, I mean, I'm not showing you the front, I'm not showing you the x-rays, I'm not showing you any of the details there. I just want you to observe this stuff when you're in the store, so you can be as frustrated and pissed off as I am when I go in there. Because that bump up there, that top bump, he doesn't have a beautiful kyphosis in the left picture. He has an accentuated kyphosis, then a flat spot, then a curve. That accentuated kyphosis is right over the sympathetic nerve supply to the heart, so his body is adapting. It's opening up that because he did have cardiac arrhythmias. And so when you see that bump above the kyphosis, you can say, wow, any cardiac arrhythmias? Any you know, you feel a little fluttering in your heart, and then take a deep breath and it goes away? What does he say? Yeah. What do 90% of the people that have that same distortion say? Well, yeah, but I thought it was normal. Yeah, I thought it ran in my family. Yeah, it's mind-blowing. So you should get heart palpitations when you're sitting next to your sweetheart. That's about it. Okay. So when you're looking next to it, the kyphosis is restored. So how do you fix that? How do you fix that? So let's say that you sit a lot during the day. Bam, that flattens the curve out. Head goes forward, neck is forward. So this is what you're like when you're trucking or when you're at the office, when you're doing anything, okay? Now, how about we restore the curve while you're sitting? God, that sounds hard. So we have this foam block. You can also use a water bottle. And this one is pretty dense, okay? Like my hands are pretty strong and it's really hard for me to squeeze it. Okay, and this goes right at the bottom of the elbows, the bottom of this. What does that do to the spine? What does that do to forward head carriage? Well, it's placed right here at the junction of the rib cage and low back. So you can't really see this, but imagine you got 12 ribs coming off of this. So that rib area, this is like a block, Okay, the rib, the thoracic area, doesn't move a whole bunch because it's designed to be a stable platform for these cranes to come off to grab stuff. Okay, but you got a mobile neck and a mobile lumbar. So this area is placed right at the junction of the low back and of the neck area. And so what does that do? That restores the curve. And wait a second, did you see that? I put the curve in there. What happens to the upper portion? Oh my gosh, you reposition that head. Now, how long should you leave it in there? How about for 20 minutes? Why? Because there's a rule, a law, that if you put anything under a force load, let go of it, it retains its shape. That's an elastic deformation. But if you put it under a good enough force load for a longer period of time, it retains a new shape. Okay? That's called the plastic elastic deformation curve. Well, human tissue crosses that at 18 minutes. So how long do you think you need to leave that foam piece in there? 18 minutes. That's so right. Okay, but this is also why, how many times have you heard, only 20 minutes a day, you can do this ab workout and your abs are going to be perfect. You heard that? Yeah, they're using the plastic elastic deformation biomechanics curve of human tissue. So it's always that. So you put this in there 20 minutes. And also, now this is hugely important, the spinal cord does not go all the way down to the base. Okay, the cord itself stops up here at the junction of the rib cage and low back. So if you're putting this under pressure, that's called cauda equina syndrome. That means you're shutting off the nerve supply to the entire gastrointestinal tract. So if you have a postural distortion where you're sitting all the time, can this negatively affect the gut? Absolutely. The gut is 80% of the immune system. Okay, so this is one way that you can help it. 20 minutes in, 10 minutes out, the whole time you're sitting. So if you're sitting for 5-6 hours, beautiful. But then you have to, and you can also use an IKEA water bottle. Great design, wonderful, amazing. Bottom of the elbow is where the bottom of this goes, 20 minutes in, 10 minutes out. You can roll up a t-shirt, something. But that's how you correct it. And you can see the kyphosis is restored. But if you're taking blood pressure medications, your body is going to be forward, your head's going to be off, you're going to be walking more like this instead of like this. Okay, those are all clues of lack of oxygen to the brain. It's interesting because when we talk about this, you can see how the spine is distorted. Okay, now, again, when we're talking about muscles, the muscles that run down either side of the spine, you do not have conscious control over. They increase in tone under nerve pressure. But here's the weird part. When you bend like this, instantly, the muscles on the convexity spasm out. And the muscles inside relax. So when you're bending off to the side, these muscles are not pulling me down. These muscles are slowing my descent. Okay, does that make sense? Now this happens also when we adjust a person and they're laying face down. We're going to go through, and this person here is pretty common, surprisingly. Okay, where we have a curve here and a curve here. So on this person, there's going to be a spasm here, a spasm here, and a spasm here. And what we do is, and this is why we do post x-rays and why we do pre-x-rays, because we want to find out, I don't know, what do you think? Why the spasm's there? Duh. Okay. And so then by changing the sensors on this, because you've got 3 sensors here. You've got mechanoreceptors inside of the joints. You got muscle spinoreceptors in these little tiny intrinsic muscles, and the ligaments have sensors. So in order to correct this posture to this posture, we have to change the brain's awareness of the body, or proprioception. So you're not going to do it through, massaging or ultrasounding or electric stim. You literally have to change the structures in the area that communicate to the brain. Then you can decrease that lateral deviation and correct the problem. Does that make sense? I know it seems too simple. But it's kind of like ask critical thinking, why is the spasm there? Here's a gal. Does she have a beautiful curve in the back, or a bump, a flat, and a curve? Bump, a flat, and a curve, man, it ain't there. But also, too, when you're standing, okay, and you're standing in a relaxed position, the hands, you should be able to see the thumbs. Okay, if my body is like this, I'm going to round over. So what happens when your shoulders start to round over? You see the palms like this. I mean, how many times have you seen, the gym rats? Guys with massive chests like this, they're walking around like this. That's because their front is way, way tighter and they're walking around like this. But that's also a way to open up the middle of the thoracic area. So if this person has had a trauma, okay, straightening the curve in the neck, this is going to be compressed. And you can see because instead of curving out there, it curves in. That's completely abnormal. So her body is going to have massive compression here, massive. And if you have compression, you can make it worse by going back like this, or you can make it better by going like this. Does that make sense? So the postural distortions aren't just looking at the head, the ear, the shape of the kyphosis, but also looking at the hands. Does that make sense? So do you have heart palpitations? Yeah, absolutely. Then what about other stuff? Okay, anxiety, stress, blood pressure, digestion, all of this stuff. Is that pertinent to ask her? Absolutely. Here's a guy, and you can see literally a bump on the base of his neck. And it's interesting because we're talking old traumas, this, that, but when you see that, is that normal? I'm going to tell you right now, if somebody says it runs in my family, I'm going to slap you, okay? Okay, because it doesn't. You're all the same basic design. You're designed in the image and likeness of God. It's really, really cool. It's been there for a long time. If you don't believe that, it's, good evolution, okay? But this is an abnormal pathology, and you can see his head's going forward a lot. When you correct or reduce that bump by restoring the curve, the body posture changes. Does that make sense? Okay. Now, also, have you ever seen anyone with shaking? Yeah. What is that? So when you look at it, if you're shaking your hand, that's the brain not having full communication because the brain needs constant proprioceptive influences from the joints. If there is a problem, like an accident or loss of curve or something, the brain's going to send a motor impulse down to start getting more information coming back from the joint. That's just how systems work. And there's also why when we get kids with seizures, which is happening like crazy now, okay, from the neurotoxins that we're injecting in there, we give them cross-crawl exercises in order to get the brain to calm down. Okay, and we do that also to patients with MS, Parkinson's, and that getting both halves of the brain to fire make a big, big difference. So when we're looking at this, FHC is forward head carriage. Okay, how much forward head carriage was that? Kyphosis, was it increased, decreased, altered, shifted? Okay, does that make sense? Lateral translation. Here's a guy, okay, you're talking beyond mid-70s, super bitchin' healthy. Okay, I mean, a freaking rock of a guy. Now, what you'll see in here, he's got a pretty damn good kyphosis, doesn't he? And his posture, when you look at his shoulders, that's good. Now, this guy is a worker. He's worked his whole life. You can see there's probably not a lot of sitting or lax activity. But also, when we see people that have had multiple traumas, and you can't live 3/4 of a century without having trauma. But if you have a trauma and you deal with it by taking a pain reliever and not moving the joint, guess what happens to the joint? Okay, it destroys. But what you're looking at here is a decent posture. So I'll say, if I see trauma on a guy like this, I'll say, wow, you never missed a day of work in your life. You know what he says? Never. It's like, damn, buddy. I believe you. Okay, but this is cool too. So it's not just pathology, it's looking at how the body reacts. So if you see on an x-ray, and this is talking to chiropractors and regular humans out there, that if you see a pathology on it, but you see a posture corresponding to this, that is a brilliant adaptation. Now you can still fix the structure, but he has been moving for years. He's a 27-year-old guy. Okay. Now, generally, when you're looking, okay, the dominant shoulder is usually a little lower. Okay, so this is why, if you've ever seen Born Identity, It says, yeah, that person's right-handed and they're carrying a 9mm. It's like, how do they know they're right-handed? Because the dominant shoulder is slightly lower. This is a lot more than slightly. Okay, now also, what are we looking at his hands? We can see a little bit of his thumbs. They're not completely internally rotated. Okay, so his body posture is like this, and like this. Okay, so what kind of trauma has he had? Does he have a loss of curve in the neck? If you're standing like that, now you could sit like this, just sit like this for a minute. Try it. Comfortable? How'd you like to walk around all day like this? Okay, what if he presented with fatigue? You would say, duh. Just standing there, your body's working harder against gravity. I mean, you can't do this stuff forever. I mean, you look at it and observe. So looking at posture is everything, because it is a window to your health. Does that make sense? So if you have somebody that understands postural distortions like this, okay, now you can see his left shoulder is up, right shoulder's down. Okay, does that mean he's got chronic spasms over here to try and straighten it, over here to open it up? Because if you have right-sided spasms, just for the heck of it, that means this right side is contracting. Is it because it's opening up the nerve on the other side? Could be. If you have right-sided spasm, could it be that the head's forward and it's trying to reposition it? Could be. Could you have numbness and tingling in the left side causing that right-sided spasm to correct itself? Could be. Okay, a lot of questions like this, but this is how real doctors think. Okay, you don't go in there with no critical thinking and say, you're spasm, here's this. Okay, here's a kid. Okay, what do his hands look like? Are they normal? Can you see the thumbs? Or are they internally rotated like this? Okay, so now let's say he's a workout guy. Is he doing appropriate stretches? Does he have a good curve in the neck? Is there a lateral deviation here? Absolutely. Now, if he's a kid, in this day and age, has he been vaccinated? Okay, fully vaccinated, partially vaccinated. If he's fully vaccinated and he's 18, he's had 72 doses of 17 different vaccines. You can't really tell, but there's like a little pink hue to his skin. And that, if you see pink skin in a kid that's fully vaccinated, you can touch it and it'll turn white. Okay, that means that there's histamines released everywhere. So you see a kid that's around 18, internally rotated with pink skin, what's their bowel function like? Does that make sense? What's any anxiety or stress knowing that this is where 80% of the immune system and neurotransmitters are there? Okay, now imagine if you walk through Target or Walmart and you saw this stuff. Would that drive you crazy or crazy? Because these are people suffering in a delusional situation where they have people giving them toxic chemicals based in a system that's only 150 years old. I mean, we're not talking about a vaccine that was 8 weeks studied. Okay, that's 2 of them are being pulled off the market after a couple of months of trial. Okay, so we're looking at a massive histamine release and damage to the tissue. Here's a guy, great guy, but is he standing straight or off to the side? Now, if somebody's standing off to the side, could that be a knee issue, a foot issue? Because if your right leg's hurting, you're going to start to shift your weight off. Does that make sense? That's we also do balance tests. Now, this could be a brain thing, could be post-stroke, could be a hip issue, could be a knee issue, could be a foot issue. But when you see somebody walking like this, they're adapting to something. So if somebody comes in with a hip, knee, or foot issue, we know that there's going to be some type of an adaptation. Does that make sense? So when people say, yeah, you only look at the spine. Okay, but it's really identifying the adaptation, because is high blood pressure a disease or an adaptation? Is high cholesterol a disease or an adaptation? Is pain a disease or an adaptation? It's a clue. It's a friggin' alarm bell telling you there's something going on. Okay, then if you want to get into the neurology, anxiety, stress, depression, impulse control, that's a feature of the frontal lobe. The frontal lobe is controlled by the cerebellum. If you have, and any position of that spine is sending signals to that cerebellum. So if you've had a hurt knee, hurt leg, or anything else, and that alters gait, so you're walking like this, does that mean you're going to get alternate signals going up to the cerebellum? Yes or yes? Okay, you get that. What does that do to the frontal lobe? Does that have healthy function or abnormal function? Abnormal. And it's like, oh my God, you're looking at posture analysis and identifying anxiety and stress. No, we're just looking at adaptations because it's foolishness to diagnose a disease and give a therapy because those diseases most of the time are adaptations. Okay, you ready to say it with me? Wow! My God, that makes sense. I wish all doctors thought this way. Okay, so look at this. We've got a belief system, and it's called the allopathic model. I didn't say allopathetic, so I'm being nice. Okay, wait, I just did say allopathetic. Okay, so you have this model based in symptom and therapy. Okay, you have a symptom, you got an ill, we got a pill. Okay, and this is only since about the 1900s. I mean, there were snake oil salesmen for forever. But do you have a problem with the model? Is our population the healthiest it's ever been, or is it sick? It's sick. 50% of our animal species, and I'm talking humans, are going to get some kind of cancer. Okay, and that's a toxic assault, but it's also an adaptation to toxins. So we're going to get it back, and we're going to get into health freedom. And the next few weeks, the more I learn about really getting your rights back, you're going to like this.